Have you ever stopped to think that the medicines on your shelf can be both your allies and your enemies? That's right, while they relieve pain, fight infections, and regulate chronic conditions, many common medications can actually be putting your kidneys at risk. This surprising fact is an alert that few people know about, but it can make all the difference in your long-term health. Imagine discovering that your habit of taking an anti-inflammatory for that back pain or an antibiotic for an infection is silently compromising your kidneys, the natural filters of your body. In this guide, we will explore together the medications that can harm your kidneys and how you can protect yourself. Get ready to be surprised and, above all, learn how to take better care of your health. Medication risks. It is intriguing how many of the medications we take daily, with the intention of improving our health, can actually pose a risk to our kidneys. These vital organs, which function as the body's filters, can be seriously affected by certain medications. For example, common medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, and some antibiotics are known to cause kidney damage. And we're not just talking about minor complications, but conditions that can lead to complete kidney failure. Often, the harmful effects of medications on the kidneys depend on the administered dose or the frequency of use. A practical example is the prolonged use of ibuprofen for chronic pain. Although initially effective, constant use can result in a gradual decrease in kidney function. Can you imagine the impact of this on your life? The need for regular dialysis or, in extreme cases, the anxious wait for a kidney transplant. Therefore, it is crucial to follow medical guidelines and not self-medicate. And here is a point that often goes unnoticed: the risk is real for everyone, regardless of age or health condition. Imagine a young athlete using diuretics to improve sports performance or an elderly person taking multiple prescribed medications. Both may be putting their kidneys at risk without knowing it. Therefore, it is essential to be aware of the risks and discuss with your doctor the best way to protect your kidneys when taking any medication. This leads us to reflect on the different ways medications can affect our vital organs. Types of toxicity. Not all kidney damage caused by medications is the same. There is a significant difference between dose-dependent and idiosyncratic toxicity. In dose-dependent toxicity, the greater the amount of medication ingested, the greater the damage to the kidneys. A clear example is the abuse of anti-inflammatory drugs such as ibuprofen, where excessive and prolonged use can lead to severe kidney dysfunction. On the other hand, we have idiosyncratic toxicity, which is a bit more treacherous. In this situation, the damage does not depend on the amount ingested but on an unpredictable reaction of the body to the medication. This means that even small doses can cause significant adverse reactions in some people. Imagine a person taking a common antibiotic like amoxicillin and suddenly facing serious kidney problems without any apparent reason. Therefore, understanding these types of toxicity is crucial for taking effective preventive measures. Always consult your doctor before starting any new medication and inform them about any history of adverse reactions to medications. This can help avoid unpleasant surprises and protect your kidneys from irreparable damage. And speaking of antibiotics, let's explore how these medications can be harmful to the kidneys. Antibiotics. Antibiotics are essential in fighting infections, but caution is needed. Medications like Cipro and amoxicillin, when used improperly, can cause serious kidney damage. Imagine treating a simple urinary infection and ending up developing a serious kidney problem due to the improper use of antibiotics. It's a risk that many people do not consider when self-medicating. The issue with antibiotics is not limited to dosage but also the duration of treatment. Often, people stop using them as soon as they feel better, without completing the prescribed cycle. This can not only reduce the effectiveness of the treatment but also increase bacterial resistance and, in extreme cases, overload the kidneys. Therefore, always follow your doctor's recommendations to the end, even if the symptoms disappear earlier. Moreover, some antibiotics have specific toxic effects on the kidneys. For example, prolonged use of aminoglycoside antibiotics can lead to a condition called nephrotoxicity, where kidney tissues are directly damaged. To avoid these problems, it is crucial to have regular kidney function tests when using these medications for long periods. Moving from antibiotics, let's explore how common pain medications can be equally harmful. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin, are often used to relieve pain and inflammation. However, few people know that these medications can cause acute kidney injury, especially when used in excess or for long periods. Imagine that persistent headache leading to daily consumption of ibuprofen. It may seem harmless, but in the long run, it can result in an unexpected visit to the nephrologist. The problem with NSAIDs is that they can reduce blood flow to the kidneys, impairing their ability to filter waste from the body. This effect is even more pronounced in people who already have risk factors such as hypertension or diabetes. A common story is that of athletes who use these medications to continue training, ignoring the pain. This behavior can accelerate the deterioration of kidney function, turning a common practice into a serious health problem. To mitigate these risks, it is essential to use NSAIDs only under medical guidance and seek alternatives for pain relief whenever possible. Non-medication methods such as physical therapy, relaxation techniques, and dietary changes can be equally effective and much less harmful to the kidneys. Now, let's dive into how diuretics, used to reduce fluid retention, can be a double-edged sword for kidney health. Diuretics. Diuretics are often prescribed to help with fluid retention, but their excessive use can be harmful to the kidneys. These medications increase urine production, helping to eliminate excess fluids from the body. However, when used improperly, they can lead to severe dehydration, putting unnecessary pressure on the kidneys. Imagine an elderly person taking diuretics without proper supervision and ending up with kidney problems due to dehydration. Dehydration is a silent enemy. It reduces blood flow to the kidneys, limiting their ability to filter toxins and waste. This can result in acute kidney damage and, in extreme cases, lead to kidney failure. A practical example is the use of diuretics in high-performance sports for rapid weight loss. Without adequate fluid replacement, the kidneys can suffer serious consequences. To use diuretics safely, it is vital to follow medical guidelines and closely monitor signs of dehydration, such as extreme thirst, dry mouth, and dark urine. Additionally, it is important to balance the use of diuretics with adequate fluid intake. Moving on, let's explore how proton pump inhibitors, PPIs, commonly used to treat acid reflux, can also impact kidney health. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, such as omeprazole and lansoprazole, are widely used to treat acid reflux and stomach ulcers. Despite being effective, their prolonged use can bring serious risks to the kidneys. Studies have shown that these medications can cause a condition called acute interstitial nephritis, where kidney tissue becomes inflamed, resulting in reduced kidney function. A practical example is a person suffering from chronic heartburn and resorting to daily use of PPIs without medical guidance. This continuous use can, over time, seriously compromise kidney health. Additionally, there is evidence suggesting an association between prolonged use of PPIs and chronic kidney disease, which can slowly progress and go unnoticed until significant damage is done. To minimize these risks, it is crucial that PPIs are used as prescribed by a doctor and for limited periods. Natural alternatives, such as dietary and lifestyle adjustments, can be explored to control acid reflux symptoms. Moving from PPIs, let's now understand how angiotensin-converting enzyme inhibitors, ACE inhibitors, despite their benefits, can become harmful when combined with other medications or in certain conditions. ACE inhibitors. Angiotensin-converting enzyme inhibitors, ACE inhibitors, are widely recognized for their benefits in reducing blood pressure and protecting kidney health, especially in patients with diabetes. However, when combined with medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, or used in dehydrated patients, they can pose a considerable risk to the kidneys. Imagine a hypertensive patient who, taking ACE inhibitors and NSAIDs simultaneously, faces a serious risk of acute kidney injury. The dangerous combination of ACE inhibitors with NSAIDs can drastically reduce blood flow to the kidneys, compromising their function. This is particularly problematic for people already at risk, such as the elderly or those with chronic diseases. A real example is a patient taking ibuprofen for joint pain along with ACE inhibitors for high blood pressure, unaware that they are overloading their kidneys. Therefore, it is vital to have open communication with the doctor about all medications being used, including over-the-counter ones. Staying hydrated and avoiding the use of NSAIDs without medical guidance are essential practices to minimize the risks. Now, let's explore how antiviral drugs, essential in treating severe infections, can also have a negative impact on the kidneys. Antiviral drugs. Antiviral medications are crucial in fighting serious viral infections such as HIV and hepatitis, but they can come at a high price for the kidneys. These treatments can cause kidney damage through direct toxicity or by the accumulation of crystals in the renal tubules. Imagine a patient in continuous treatment for HIV who, unknowingly, begins to face kidney problems due to the medication. It is a situation that highlights the need for careful monitoring. Direct toxicity occurs when antivirals directly affect kidney cells, compromising their function. A practical example is the use of tenofovir, a potent antiviral, which can lead to kidney dysfunction over time. For these patients, regular kidney function tests are essential to detect problems early and adjust treatment as necessary. Additionally, some antivirals can cause the formation of crystals that accumulate in the kidneys, blocking the renal tubules and impairing waste filtration. To avoid these problems, it is crucial that patients maintain good hydration and strictly follow medical guidelines. Continuing our journey through medications that can affect the kidneys, let's talk about lithium, a common treatment for mental health conditions, and its renal impacts. Lithium. Lithium is a medication widely used in the treatment of mental health disorders such as bipolar disorder, but its long-term use can bring serious problems for the kidneys. It is known to cause a condition called nephrogenic diabetes insipidus, where the kidneys lose the ability to concentrate urine, leading to excessive urine production and constant thirst. Imagine a bipolar patient who relies on lithium to stabilize their mood but over the years begins to face significant kidney difficulties. Lithium nephrotoxicity occurs because it can cause structural and functional changes in the kidneys, impairing their ability to filter blood properly. A practical example is a patient who needs to regularly monitor their blood lithium levels and undergo kidney function tests to avoid complications. The combination of medical supervision and dosage adjustments can help mitigate these risks. For those who depend on lithium, it is crucial to discuss alternatives and treatment strategies with their doctors. This can include combining lithium with other medications that have a lower impact on the kidneys or exploring non-drug therapies for mental health. And so, we conclude our analysis of medications that can affect the kidneys, but we cannot stop here. It is time to reflect on how to apply this knowledge practically and protect our kidneys from future damage. Now that you have discovered how various medications can impact your kidney health, it is time to take action. Ask yourself, am I taking my medications correctly? Am I aware of the possible risks? Awareness is the first step, but applying it is what will make the difference. Don't wait until a kidney problem appears to take preventive measures. Regularly consult your doctor, follow the guidelines, and whenever possible, seek natural and less aggressive alternatives. Are you ready to make changes that truly protect your kidneys? Think about the small actions you can start implementing today. Replace that common painkiller with non-drug pain relief methods, stay well hydrated, and be vigilant with the use of antibiotics. These changes may seem small, but they have the potential to avoid serious damage in the future. So, let's go. Put this knowledge into practice and keep learning more about how to take care of your health. Subscribe to our channel and turn on notifications so you don't miss any new content. Your kidney health thanks you.